Let's take a closer look here at where the rectus femoris is located. Now, obviously, this is going to be a front anatomical view of the pelvis and the thighs. It'll come down here, go to the patella, and the patella it'll come over and go into what's called the tibial tuberosity, like that. Okay, so that's the right rectus femoris, and of course the left rectus femoris. They're always going to work together as a functional unit and functional pair. You can get a lot of tension, tightness, restrictions in here. Some people may call them trigger points. I just call them excess tension. What that can cause or may cause are symptoms here around the hip socket. So you feel hip issues, groin issues, and all the way down into, hey doc, my kneecap hurts, or I have pain below the kneecap here, and everybody starts treating here, which is okay. You should do that for sure, but take a look up top, and of course pay attention to the whole pathway of that rectus femoris. Now let's go over the actions of the rectus femoris from its concentric actions and eccentric actions and the difference between the two. Let's take a look at the actions of the rectus femoris, starting at the hip joint first. The concentric action, that means its shortening action, will be hip flexion. So this brings the hip up into flexion. And you can use this a lot when you do what? Like walking, right? Now that's concentric, but it also has an eccentric action. Eccentric is the opposite. That's actually where the muscle starts to lengthen to control hip extension. So bringing your hip back using your glute muscle will elongate that rectus femoris muscle. So it eccentrically controls hip extension. So this is important because if you have an imbalance from your glute muscles maybe not doing enough, which they probably are, because many people have glutes that are weak because they sit on them all the time and they don't use them a lot, then it gets an imbalance into this rectus femoris here. Now also you have to remember another muscle that sits deeper here that attaches from the spine into that hip, called your psoas muscle, one on the right, one on the left. That also flexes the hip up like this. So these can work in tandem. Now, what can happen is if you have an psoas issue, PSOAS, that may mean you can also overuse the quad because the quad has to start doing the work, or it can go vice versa. Like this rectus femoris quad muscle may not be working well, tightness of tension, and then the psoas muscle has to do the uptake. It says, hey, no worries, my friend, I'll take over the load for you, you'll be good. But then down the line, that can cause an issue, right? Where you'll feel your discomfort often when you have a problem with this rectus femoris is in the inguinal region, a lot of stuff in the thigh itself. It can lead to sacroiliac issues because you don't have good stabilization in your pelvis. Okay. Now, what I didn't mention on the skeleton were the actual pelvic bones that sit here. So you have a right pelvis and a left pelvis this way, and they tilt. So they can tilt forward, which is called an anterior pelvic tilt. And that means you have an increased curvature in the lower back. But if they tilt forward, you can see what that might do to the rectus femoris. They can also tilt backwards. That's called a butt tuck, pulling up underneath, or a thrust. And that gives you a posterior pelvic tilt, which is going to do what? It can also impact that rectus femoris on here. So that's why pelvic position matters. But the pelvis also reacts to what's happening down in the feet. So if you have flat feet, if you have supinated feet, if you have stuff going on there, it can also feed up into this region. So I want you to see there's a lot of working parts here, but we're going to focus primarily in this region here on that neglected rectus femoris region. Now, what happens at the knee? Well, if you've ever gone to the gym and you've sat in one of those exercise machines and you sit and then you extend your leg out, it's called leg extensions. That's to isolate the quad. So that's concentric action at the knee joint. It shortens. The quad muscle shortens and then it pulls into extension at the knee. Now, what is the eccentric action? Well, flexion of the knee is when you bend it like you're sitting in a chair or you're doing what they call a hamstring curl at the gym. That means this rectus femoris muscle is now going to lengthen. So it eccentrically controls knee what? Flexion. So you can have issues what? In your hamstring because you have quad issues, because when you shorten the hamstring, the quad should what? Lengthen. So my question is, what happens if the quad can't lengthen well because it's too tight at the top or in the middle or at the bottom, and then you pull it that way, you can start to get cramping here, pain here, stuff in between. It can go chaos anywhere it wants, right? So if you're always chasing tight hamstrings, maybe, just maybe, check up in the front here and see if it helps. So I'm going to give you a couple of options to work this place higher up here. And then you can actually go a little bit further into the quad if you want. But this is the sweet spot right near that anterior superior iliac spine. All right, here we go. This is the anterior superior iliac spine on the right. That's the anterior superior iliac spine on the left. And this is where I want you to place the different devices. So if you're using the vibration ball, put it right up underneath, not on it, just up underneath. If you're using a foam roller, same thing, just up underneath. And if you're using something like my friends at Block Therapy, right there. So let's look at the video coming on up. I'll show you different options. All right. I'm going to show you this on my treatment table, but you can certainly do this down on the ground, whatever is comfortable for you. I'll show you a few options. My favorite is using a vibration massage ball. This is our Mojo vibration ball. If you want to order that, you can do that on our website. Any vibration ball will do. We like that one the most. You can use foam rollers of different sizes, different textures. If you want to go hard style, a yoga block will get in there. And then, of course, the block therapy, which I actually like a lot. You can use that in there. The most important thing is the awareness to work that region. The tools I want you to explore with. In relationship to something like how often, how long, how many times, the answer is yes, it depends. Just remember that more isn't better, better is better. These areas, if they're painful, that means there's inflammation there. You want to work it, but you have to be careful. I don't want you to put yourself in agony trying to relieve pain by giving yourself more pain. That usually doesn't work out well for you because your nervous system tightens up and it can try to push back, which means that you can feel worse because you just did too much. Make sure you always do both sides, no matter what. I'll give you a couple of examples. Let me show you with the vibration ball first. I'll turn that on. I like to do a second or third setting. And you'll move around and put it right in front of that anterior superior iliac spine, lying down on it. I'm on my elbows to take a little bit of pressure. And then, oh, there it is. Holy cow, that feels really awesome. Breathe it out. And if you can see down below, watch, I'm going to flex my knee up. So you see how I'm bringing my, like I'm doing a hamstring curl. That'll be a little bit more intense because I'm actually lengthening that rectus femoris, and you'll really feel it at that origin spot right there. So back off a little bit if you need to, but don't cramp in your hamstring. And oh, that's good. I may hold that one for a second. I like the vibration a lot because the vibration helps disperse a lot of those cytokines and inflammatory chemicals that get around there that can be causing some of the pain. And the vibration helps with what they call the nociceptors there to calm them down. Those are the sensors that send things to the brain that can be interpreted as pain. Um, Foam roller gets in there too. I'll go like that at the top. That's a little bit more intense because of the pressure. And if you like, you can certainly roll all the way down the quad, but start up at the top and hang out there for a little bit longer. So good. And then, of course, you can use the block therapy one. That's a pretty sweet one as well. And get in there like that. I'm not going to show you the yoga block one because you get the general idea. Plus a yoga block. I mean, that's uber intense. I'm not feeling like I want to go there today. And I'm not going to show you the opposite side because you get the general idea. Okay? Well, that's how you do it. Let's just move into a brief summary. How about that? Easy peasy, right? So why do you want to do the rectus femoris? If you have pain in the hip, in the groin region, the knee, the pelvis, sacroiliac joint in the back, honestly, even all the way down to your foot, give this a shot and check it out. The reason this can be so powerful is because people don't realize how tender that spot is until they start to dig in there because they're experiencing the symptoms somewhere else. That's called referred pain. And that's a lot of what stop chasing pain means. It means I want you to treat pain, but I don't want you to chase it. Chase it means that wherever I point is where you start to do something to it. Don't wait until it hurts because, first of all, just because it hurts there doesn't mean that that's the biggest place that you should be focusing on. How can you tell? Well, if you do a lot of stuff to an area and it's not changing, that's a pretty good signal that you're in the wrong spot. All right. So try these out, see if they help, and please leave a comment below on any thoughts that you have, how you felt when you did it. Make sure you share it with other people as well. And you can also leave comments below of things, topics, subjects you'd like to see me post on. If I think I can add some value to that, I certainly will. I'd like to end by saying, remember our fundamental phrases that we teach everybody. No system in the body ever works alone. It never gets injured alone. It never heals alone. There's no such thing as an isolated injury. There's no such thing as isolated healing. It's all or nothing until lights out. The body is one piece, one unit. Everything tries to help everything else out. That's the way it works. And please remember that your body is always trying to do the best it can with what it's got in the moment it's in to heal and protect you. That's its job. It doesn't want to be in pain and suffering any more than you do. And we hope that some of the things that we're teaching you on our channel can help you feel just a little bit better and take back control of your life from pain or discomfort that you might be feeling. Thank you so much, everybody, for tuning in to Stop Chasing Pain, our channel, and for watching. We truly thank you. We'll see you soon on the next video. Take care.